enter the room.
Hello, good morning. Hello, good morning.
Good morning.
One of the FI2 doctors in the GP surgery. Can you please confirm your full name and age?
My name is Thomas Harris and I'm 40 years old.
All right. What would you like me to call you?
Thomas is fine.
Okay, nice to meet you, Thomas. So, what brought you here today?
Doctor, I couldn't hear anything in my right ear from this morning. It feels like my ear is blocked.
Okay, I can understand it must be quite discomforting for you. So, is it only the right ear, or is there something wrong with the left ear also?
It's just my right ear.
Okay. So, you said it started since the morning. So, did it start suddenly or was it gradual?
Well, actually, the hearing problems started suddenly yesterday.
Okay. Okay. And is it continuously from since then, or does it comes and goes?
It's been continuous since yesterday. I can't even hear anything from my right side.
Okay. So can you tell me on a scale of 1 to 10 how bad it is?
It's quite bad, Doc. I would put it at an 8 out of 10.
Okay, I understand. So can you tell me, is there any other symptom apart from this?
Well, I didn't have any other issues like ringing in my ear, if that's what you're asking.
Okay. So you're saying that ringing in your ear is present, right?
No, I don't have
Oh,
ringing in my ear. I don't
oh,
have any pain.
okay. So there is no pain, no ringing of the ear, and any discharge?
No,
Okay. And any pressure or fullness in the ear?
yes, like I said before, it feels like my ear is blocked.
Okay. All right. And the left ear is completely all right, right?
Yes.
Okay. Thank you for answering that. So, do you have any specific medical conditions ongoing?
No,
Okay. And are there any hearing issues in your family?
no,
Okay.
just me.
So, are you currently taking any medications?
No, I don't take any medications, doc.
Okay. And are you allergic to anything?
No.
All right. And what do you do for the living?
Well, doc, I work at a telephone communications company and I cannot make calls in the office since my symptoms started.
Okay. All right. So, do you use that headphones at the office?
Yes, I use my headphones and I usually use the right side to attend to the phone.
Okay. I understand. So, by any chance, is there any trauma to your ear?
No, I can't say that.
Okay, all right. So you told me that it is affecting your work. So is it affecting you at home as well, or is any other thing way?
No, I just live alone and I'm mostly at work. So since these symptoms started, I haven't been able to do my job correctly. As you know that I require good hearing for making calls.
Okay, that's okay. And some questions about your general life. So do you smoke or drink?
No.
Okay, that's good. Thank you for answering all of my questions. Now I would like to examine your ear. Okay, that will include looking at your ear and also examining the inside of your ear using an instrument known as otoscope. Okay. And you have to
Oh,
just sit upright, and I will be examining your ear. And during the examination, a chaperone will be present to maintain your privacy and dignity. Okay.
okay, that's
And I
fine,
will
Doctor.
also be doing the hearing test to check your hearing.
Okay, that's fine.
Okay. Okay, so I have done your examination, and based on your history, I just suspect that, as you also told me that you work at the telephone center and you have to use the headphones to hear the calls. So I might suspect that you are suffering from some hearing problem due to the headphones, overuse of the headphones. Are you understanding my point?
Well, I'm hearing what you're saying, but what exactly is wrong with me?
So sometimes it can happen that due to the overuse of the headphones, the eardrum of gets affected, and it leads to decreased hearing.
Okay, so when am I getting better?
So I will just actually consult with my senior regarding the treatment and every follow-up, etc. Okay, and as it is also affecting your life, this is affecting you at the job. So I will just make a routine referral to the ENT as well, so the specialist can examine you and just prescribe you the required treatment. Does that sound good?
Okay, so how soon can I be seen by the specialist?
Okay, and I would also
2
like
minutes
you
remaining.
to talk to your employer regarding your condition because it is affecting you at the work. So he might be able to make some changes and might be able to give you some other job at the place. Does that sound good?
Well, yes, but can I get my hearing back?
Pardon?
Will I get my hearing back?
Yes, you can. I cannot say anything right now because I need to do some more investigations and some specialist opinions. So I'm not sure at this point. But you can talk to your employer about that thing, about your workplace. And if your employer is not able to help you in any way, we can also refer you to the occupational therapist. So he will be able to make the changes that are required at the workplace environment. Okay. And we can also give you some hearing aids. The specialist will give you the hearing aids. The hearing aids will help you in better listening, make the hearing better.
Okay, doc. But you mentioned that I need to see a specialist. When am I going to be seen by the specialist?
I will be making a routine referral and no, I will be making an urgent referral, okay, because it is very much affecting your day-to-day life. So it is difficult for you to cope in your life. So I will be making an urgent referral and you will be seen by the specialist, the ENT specialist.
Okay, that's fine. Thank you so much, doc.
Okay. Is there any other concerns that you might have?
Well, I'm just a bit concerned about this sudden hearing loss and what it will mean for my job. So I guess I'll have to wait to be seen by the specialist, like you said.
Move on to the next station.
All right. Thank you, guys. Thank you, Dr. Rao, for the acting. Yes.
Yeah, I was going off script.
I
Yeah, but
haven't completed ENT yet, so I was not sure of all the diagnosis.
no problem, Dr.
That's
Rao.
fine, doc. That's fine.
But I think you did a good job. I'd like to address a few things over here. So when you mentioned that there might be some problem with the eardrum, can you explain me, if you do have a problem with the eardrum, what kind of a hearing loss will you have? You know? There are two type of hearing loss. There will be conductive
Mhm.
or there will be sensory neural. Which type of hearing loss do you think will
That
happen
will
with?
be conductive. Yeah, that will be conductive. Oh, yes. Oh, you're right.
Over here, the hearing loss, the conductive part of it will not at all come at all. So it's nothing
Yeah,
but the eardrum, right?
I
So
messed up in that.
So I just like to tell you a little bit about the conductive. Basically, whenever a sound wave comes, it hits on the tympanic membrane. The tympanic membrane emphasizes that sound. It gets transferred to the ossicles. The ossicles go in and it stimulates the cochlear. And from there, the vibrations get picked up from the endolymph and the hair and the otoliths. And then it goes into the sensory neural pathway. All right, so any problems with the conduction of the sound is a conductive hearing loss. Any problems with the nerve and the cochlear is a sensory neural hearing loss. All right, and in a conductive hearing loss, the air conduction will be less than the bone conduction over here, and that is tested by the Renee's test. So now the Renee's test is normal on both sides, meaning that the air conduction is greater than the bone conduction. Even in the affected ear, the air conduction is greater than the bone conduction. Even though it might be lesser in intensity, the hearing would be less, but the air conduction is still greater than the bone conduction. So what is your next clue? You go with the weathers, which is lateralizing to the left. After this, you know this is a sensory neural hearing loss.
Yeah, since I just guessed that it is sensory neural hearing loss, but I should not have spoken the word eardrum. I just changed it.
And yes, you're right to say that maybe it could be the telephone company itself that could be affecting this. But at this point, since it's and you don't really have a cause, so you can call it an acute idiopathic because it happened very suddenly and you don't really have a proper cause for it. It could be because of the job, but this is an acute sensory neural. So usually this we don't really acute idiopathic sensory. We don't really know why it's happening. Usually why this happens is because some inflammation is going on the nerve, right? So when this happens, you have to send them for an immediate referral. This is a 24-hour referral, and you were correct to change the referral from a routine to a thing, especially when it's affecting the life so much. Definitely you should give a urgent referral, but this is an even more urgent where this will be an immediate referral. So what the specialist does is they give corticosteroid injections to reduce the inflammation, and usually this intervention brings their hearing back. So what are the additional things that you should keep in mind before asking them anything related to any infection, right? Was it sudden, like was there any
Any
discharge?
recent infection?
Yes, that's very important.
Okay.
Yeah, if you're thinking any case of otitis media, do you usually put things in your ears, would that
Okay.
right? If you're thinking along the lines of conductive. Sensory neural, you have a whole lot of things. Do you have any dizziness, right? You're thinking of any vertigo, right? Any fullness? Fullness, you asked. Tinnitus, Dr. Farao actually gave you that tinnitus. Any other symptoms? Usually when you ask any other symptoms and you don't know what to say, the patient would say, like, what, doctor? What are the symptoms that I'm supposed to be looking out for? So usually they'll ask it. Well, they'll ask like what? Dr. Farao was kind enough to actually ask you, are you talking about ringing? I don't have that. That was nice. Awesome. So
So
guys,
the diagnosis is idiopathic sensory neural hearing loss.
it would be better if you add the word acute because this is an emergency. You have to step
Okay.
immediately to restore the hearing. Most of the times, the corticosteroid intervention does improve hearing, by the way, right? So
Okay.
idiopathic, you usually treat it, and it's sensory neural, quite frankly, because look at that.
Yeah, I knew it is sensory neural, but I didn't know how to do anything else.
Yeah, I mean, the best thing is to refer itself, especially when it's an acute presentation. It's a good thing to
Yeah.
refer, especially when the hearing is gone, right?
Yeah, I was just referring routinely, but just as I remembered that it is affecting his life, so I just did it urgent. But you're saying we should do immediate in this one.
So most of the time, there's
Okay.
an inflammation component that can be reduced immediately. So when it's an idiopathic one, this is an intervention that they do. And then if it still doesn't work, then they usually give hearing aids and cochlear implant. They may be managed accordingly. And they'll do further investigations. But that's one of the immediate treatments that they do.
Yeah, towards the end, I just remembered that there is something called an hearing aid also, which can be used. So I added it.
Absolutely. Good job. So, guys, all of you guys who are here right now, thank you so much for participating. So, as a token of appreciation, we are running a 20% discount for any of the workbench products. Unfortunately, we have to deprecate the 40% discount, and the examiner will be posting the link for the coupon that you can use to avail your 20% discount. Yes, so we'll be doing that shortly. All right, so let's quickly look at the performance. Sorry about that. All right, so let's quickly take a look. Confirm full name, age, start with consultation and inquire. 1 year, both year, ask about exact onset, gradual or sudden, ask about the duration. since hearing loss began. Ask about the progression, whether hearing is improving, worsening, or static. Ask about associated symptoms, tinnitus, dizziness, fullness of ear, recent upper respiratory tract infection. Ask about the impact on life, work, social interaction, and emotional well-being. Perform general physical examination, observe general observation, ear examination, otoscopic examination, Rennie, Weber's, especially when it's hearing loss. Think of the hearing test right away, even before the otoscopy, right? You're thinking hearing loss, so you need to understand in your mind what type of hearing loss am I thinking, right? Inquire about any recent infection, trauma, or exposure to loud noises. Ask about facial weakness, numbness to rule out neurological causes. This is usually seen in, anybody can answer that, any neurological causes. In which condition would you be able to say that? In acoustic neuroma.
Acoustic neuroma.
Absolutely. Absolutely, Dr. Ibrahim. All right. Ask about recent exposure to loud noises. Yeah, I think infection, trauma, exposure to loud noises, occupational noise hazards, right? Management. Inform patient about urgent referral within 24 hours, right? Explain the diagnosis clearly as sudden sensorineural hearing loss due to nerve damage. But you don't know why the nerve is getting damaged, right? At this point. Explain the exact cause is often unknown but requires urgent treatment. Explain that the ENT will perform detailed hearing tests such as an audiometry. Explain that the ENT may prescribe corticosteroids to improve hearing recovery. Emphasize the importance of starting treatment within 72 hours for better prognosis. Reassure that most people recover hearing partially or completely with prompt treatment. Advise follow-up with ENT within 1 to 2 weeks after the treatment initiation. Provide safety netting. Seek immediate help if worsening hearing, dizziness, balance problem, or facial weakness develop. Offer patient information leaflets about sudden sensorineural hearing loss and ENT referral process. All right, and interpersonal skills show empathy, understanding of for anxiety and concern about hearing loss. Reassurance provides support, reassuring the patient's feelings, reassuring the patient feelings heard and understood. Reassure patient that you are arranging urgent help today to give him the best chance of recovery. Clear communication, use simple language to explain medical terms and procedures. Signpost, ensure the patient understands urgency and importance of the ENT referral. Confirm understanding, ask the patient to repeat key information to ensure clarity. Right? But awesome, that was great. Good job, Dr. Sana. And that brings us to the end of today's session. Thank you so much, everybody, for participating. And we will be dropping the link for you guys to book the slots for Wednesdays. You can also book it for any other days that will be available. And if you are interested in the case repeat mock, there is another form that I would like you guys to fill. I'm posting that as well. You can fill that form for if you want case repeat mock. Unfortunately, today's case repeat mock candidate did not arrive. So it's open for Wednesdays. You guys can definitely book it. First person to submit it will be getting the case repeat mock. The rest of you guys have to go through a quiz after registration. But thank you so much, everybody, for participating. I will see you guys on Wednesday next. Bye-bye.